Dear colleagues, in this video we show you the treatment of acute disease with polarity analysis, and we demonstrate the treatment of an acute Covid-19 case. In every epidemic disease we observe several stages. Most of the patients in epidemics have mild or moderate disease, and only a smaller percentage goes on to severe, and even a smaller one to catastrophic disease. In the Covid-19 epidemic in China and Italy, there were 80% mild and moderate disease, and 14% severe disease, and 6% catastrophic. The aims of Covid-19 treatment: first aim is to treat mild and moderate cases well, to prevent them to become severe. The second aim is to prevent severe disease to proceed to catastrophe. Polarity analysis is a repertorization method based on Bönninghausen's therapeutic pocketbook, and it has a corresponding software which you will see in the next slide. It allows precise remedy determinations with the key symptoms, which I will introduce to you right now. If you are not familiar with polarity analysis, please look first at the video Polarity Analysis Introduction on YouTube. You find it under this internet address. Here you see the surface of our software. You can download it from this internet address. How do we choose the best fitting remedy? The remedy with the highest polarity difference indicates the best match, provided the symptoms are reported correctly. You should also observe contraindications. Remedies that are shaded gray in our software may be problematic, because at least one of the patient's symptoms does not correspond to the genius of the remedy. These symptoms are marked with CI below the red line. I will show that right away. Here you see how we calculate the polarity difference. In the software, after you've entered the symptoms, you have this display here. The remedies, the polarity difference, here between the blue and the red line, and the patient symptoms that you entered, and below the red line we have the opposite polar symptoms of the patient symptoms. So here, for instance, uncovering aggravates is the patient symptoms, the opposite symptom is uncovering improves. Now, to calculate the polarity difference, we add all the grades of the polar patient symptoms. They are marked with a P. All the P's are polar symptoms. We add these grades and we subtract of the sum the grades of the opposite symptoms. So here we have 24 points for the polar patient symptoms and 4 points opposite symptoms. That makes this polarity difference of 20. In other words, we can say that every grade up here is an argument for this remedy, and every grade below down here is an argument against the remedy. So this difference indicates how specific the remedy is for the patient's symptoms. So here it would be hepar sulfuris and the best remedy. Contraindications you recognize as mentioned with the gray shade here. Here you have in sepia a contraindication in the symptom movement aggravates is in the first grade, and the opposite symptom movement improves is in third grade. Third grade is a genius symptom of this remedy. That means the patient's symptoms do not correspond in every aspect to the genius of sepia, and in such a constellation, a remedy rarely heals a patient. Now, during the Covid-19 epidemic, we had to make very many consultations by phone. And there we found that the best way is to ask the key symptoms of the checklist. The function checklist you have here in the software, and the key symptoms are marked yellow. So we ask the patients all about the 30 key symptoms marked yellow. It is important to point out to the patient that what he answers has to be a difference to the healthy state. So many patients say they improve with open air, but you have to have this improvement when he is ill and not when he is healthy. Otherwise, you may not use it as a symptom. Okay. Next. If we just repertorize the key symptoms in a patient, it increases the precision of the prescription and it leads to better results. You have to be aware that in certain cases you have a very high polarity difference, and yet the remedy with the highest polarity difference has a contraindication. If this is the case, it is important that you ask the patient if the symptom causing the contraindication is correct, and is really important. If it's not, you just leave it away. So it is just to say that the polarity difference is a much more important criterion for remedy selection than the contraindications. Now we show you a COVID-19 case. It is a 26-year-old woman who had a contact with a COVID-19 patient 7 days before she consulted us in our practice. Now she consults us by phone with fever, coryza, pain and swallowing, cough, severe generalized musculoskeletal pain and extreme fatigue. And in addition, she has lost her sense of smell and taste, which you know both are pathognomonic symptoms for COVID-19 disease. The patient is at home, so we take her history by phone. Now, in the next sequence, we show you with an actress how such a case taking would take place in our practice. Can you tell me why you come to our clinic?
Yes, I have very high fever, cough and pain on swallowing and muscle pain all over the body. I'm feeling very tired and also coryza.
Okay. And how long do you have this?
For 2 days now.
Okay. Did you have a corona contact?
Yeah, my boyfriend had the same symptoms a week ago and was tested positively on corona.
Okay, yeah. And how is your taste and smell?
It's worse than before.
Diminished.
It diminished, yeah.
Okay. That's very typical for corona infections.
Yeah.
About over 60% of the patients who have corona have diminished smell and taste. Okay. Now I ask you the key symptoms, the key modalities, And it is important that your answers differ from the healthy state.
Okay.
So the modalities must concern the actual disease, not the healthy state.
Okay.
Are your symptoms better in open air or better in a room?
No, open air aggravates the symptom.
Okay. So better in room?
Yes,
Yeah.
yes.
That is the same symptom actually. Open air aggravates, room better, same remedies.
Okay.
So we only take one of the two. Are they better in a cold environment or in a warm environment?
In a warm.
Warmth in general improves. Okay. That's the same thing. Cold aggravates, warmth improves, the same remedies. So only take only one.
Okay.
And do you feel better by covering yourself, wrapping up warmly, or by uncovering?
Yes, covering myself up.
Covering
Definitely.
improves. Okay. That's the same duality here. And are the symptoms better when you're lying down or when you sit or when you stand?
Standing aggravates. Lying down definitely makes me feel better.
Okay.
But sitting, I don't feel a
Same
difference when I
difference.
sit.
Okay.
Yeah.
Does it play a role if you lie on the back or on your side?
No.
No difference.
No difference.
Just lying in general.
Yes.
Okay. And after rising from the bed, do the symptoms aggravate or improve?
There's no difference.
No difference.
No.
Okay. Do the symptoms improve when you rest and don't move, or when you move?
When I don't move. Then.
Resting improves. Movement of affected part has no influence.
No.
Physical effort.
I don't do any physical effort.
Okay. So we don't take it.
No.
Are you sensitive to bright light?
No.
No. Okay. To touch or to pressure?
Also no.
No difference. Okay. Do symptoms aggravate when you speak?
No, but when I swallow.
When you swallow, okay. Swallowing aggravates. And how is your appetite?
It's normal.
Normal. And your thirst?
It's very much diminished.
Okay, thirst absent. And do you prefer cold or warm food and drink?
Doesn't matter.
No difference?
Yes.
Okay. Do you have difficulties to inspire air or to expire?
No.
No difference.
No difference.
Okay. No difficulties to breathe?
No.
Okay. Very good. And is there an aggravation when you fall asleep, during sleep, or when awaking?
No.
No
Not
difference.
at all,
Okay. So these are the key symptoms we asked you now. We have now two remedies that are up front. One is camphora, the other cocculus.
Okay. Yes.
And camphora is clearly the favorite, so you get camphora. Due to the outstanding polarity difference, camphora is the best fitting remedy. Here you see camphora, the fruits of camphora. It's a big tree, Cinnamonum camphora. Cocculus would be our second choice. It is also covering the symptoms, sense of smell and taste diminished, but they are less reliable, so we don't include them in a repertorization in the first line. If camphora would not function in this patient, we would give cocculus. So our patient receives camphora C200. 3 days later, she reports a massive improvement of 80%, no fever anymore, and her vitality has returned. The loss of smell and taste and a moderate back pain are still present, so we repeat camphora C200. 1 week after the first dose, nearly all symptoms are gone. The only remainders are a slightly diminished sense of smell and taste. So we now give Camphora M, and with that she is completely cured within a very short time. 6 weeks later we can confirm the diagnosis with an elevated SARS-CoV-2 IgG titer of 35.2. The most frequent remedies we saw in COVID-19 disease were aconite, arnica, arsenicum album, belladonna, bryonia, camphora, natrium muriaticum, nux vomica, phosphorus, pulsatilla and silicea. Of course there are also other remedies, but these were just the ones which we saw most frequently. Next. There are several internationally differing recommendations to prevent COVID-19 disease. Rajan Sankaran prevents Camphora M, taken repeatedly, for instance 1 dose a month. André Sen from Canada recommends Bryonia C30 or C200, also taken frequently. And Tony Pincus in England recommends the COVID-19 nosodin C30 and C200. We use actually, depending on the symptoms a patient normally displays, each of these recommendations individually. During the first wave of the corona epidemic, we made a prospective outcome study to know how the repertorization of the key symptoms affects our results. In that outcome study, we included all acute disease, not only corona cases. And to make a study, we first have to define our endpoints. Our endpoints were first hit, second hit, and no reaction. A first hit was counted if there is a cure with the first remedy with a massive improvement within 2 days. Second hit, cure with a reserve remedy if the first has not led to an improvement of at least 50% after 4 days. And no reaction improvement with first and second remedy below 50%, patient needs a new consultation. We had 60 patients in this outcome study, and 65% of them had a first hit, 20% a second hit, and 15% no reaction. That compares absolutely with a case taking where we make a more comprehensive case history with using the whole checklist, not only the 30 key symptoms. It is important to know that the procedure demonstrated here can be applied in any acute disease, not just in corona cases. So this is about what I have to tell you. You find further information on our website, that's the address, or on the website of the Polarity Analysis software. And if you want to learn the method, you can do that by studying this lecture book on polarity analysis in homeopathy and solving all the exercise cases in it. So that is the end. Thank you for your attention.